Hi guys, it's Tara Scott from Revitalize. It is February, and in light of Heart Health Month, I wanted to talk today a little bit about cholesterol. What I want to specifically talk about is how do you measure cholesterol? So we all agree that serum testing or blood testing is the best way to measure it, and most of us prefer to get it fasting. But there is a difference between something called a traditional lipid profile and an advanced profile. Sometimes it's referred to as a cardio IQ if you go to Quest, or the NMR profile if you go to LabCorp. So some of these labs send it out to something called Cleveland Heart Lab, which is a Cleveland lab which does advanced testing. So for example, if you get a traditional lipid panel, you'll get cholesterol, LDL, which is your bad cholesterol, HDL, which is your good cholesterol, you'll get a ratio, and you'll get your VLDL, which is your very low density. So the theory is that we used to think is that cholesterol was bad. And now what we're finding is that it's not actually cholesterol that's bad. Yes, it's bad in excess, but it also matters the breakdown. So for example, we want you to have enough of the good cholesterol and not too much of the bad cholesterol. We can further break down that LDL and see what your particle sizes are. So if you get something called an NMR, what that does is it looks at essentially the sticky cholesterol, because that's really what's going to get into the lining of the artery and cause plaque buildup. The NMR also has a further reading which looks for your insulin resistance, and insulin resistance, really cardiovascular, is going to be the key problem with not only diabetes, cardiovascular problems. I heard a podcast where Dr. Diulis talked about degenerative disc disease in your back that's going to be really from insulin resistance, brain health. So if you're not getting this test, if you have high cholesterol and you're getting treated, you may want to take a deeper look at your cholesterol. So it's an NMR. Your doctor has to be trained to read it. And basically what it does is it tells us, okay, yes, your cholesterol is high, but does it matter? Is it the LDL or the bad cholesterol? Is it the particle size that's a problem? So there is an interpretive guide that tells you, is there an increased cardiovascular risk from the way your cholesterol is? And the second part of it is, do you have insulin resistance based on how that looks? So I found this very helpful. We run it on all our patients who have metabolic issues. So it's definitely something we do at Revitalize. We are very proactive about cardiovascular health. So in honor of Heart Health on February, I hope you're getting the right kind of cholesterol checked.